So, just how much medical care should be made available to patients at the end of their lives? For more on that debate, we are joined by Henry Aaron, a senior fellow and noted healthcare expert with the Brookings Institution in Washington, D.C. Welcome to World Focus.
Thank you.
We just saw a report about how the British healthcare system will no longer provide an expensive cancer medication to patients deemed to be near death. Are such decisions likely to become more commonplace here?
Not anytime soon. The Brits spend about 40% as much as we do on health care. The sorts of decisions we need to confront are what methods of care work best, not which methods to deny people altogether.
Just how much money is spent on providing health care to patients, say, in the last months of their lives?
That's a hard question to answer because the objective of medical care is to prevent those months from being the last months. All of those who survive, by definition, are not in the last months of their lives. That said, we spend billions and billions of dollars of care on patients who are palpably and obviously very near to death. Some of that care are probably services those people would have chosen not to have had they had an opportunity to discuss what the options would be in the event, and that we all will face, of terminal illness.
Is trying to limit the amount of money spent on terminally ill patients really an appropriate way to try to bring down the cost of health care?
I don't think the objective should be to try to spend less money per se on the terminally ill. The objective that we should face in the United States is how to provide information to individuals and physicians so that they can make fully informed decisions about the kinds of care that they want to have. A system such as Great Britain's, where expenditures are a small fraction of what we spend here, need to face those kinds of questions. We are light years away from having to confront that sort of question here in the United States.
We only have a few seconds left, but there's more to this than just economics. There's a moral debate aspect, isn't there?
Yes, very much so. We're all going to die at some point. We want to have our treatment at such times be consistent with our values, our comfort. We want to spend time with our families and friends. Medical care should facilitate that, not stand in the way of it.
Henry Aaron, thank you very much for being on the program.
Thank you very much for having me.